The health center has already registered about 30 people who have expressed interest in using the site. A nurse and a dedicated drug health worker will supervise each of the rooms. Cubicles inside the safe injecting room. Photo, Darrian TraynorIt will initially operate from 9 a.m. to 5 p.m. but those hours will be soon extended. Health Minister Martin Foley said the center would stop people dying in laneways and stairwells in the nearby streets. "I'm confident its benchmarks of saving lives and improving amenity and security will be achieved," he said. In 1 year alone there had been 35 heroin-related deaths in the area, Mr. Foley said, illustrating the urgent need for an injecting room in the area. Protest flyers posted outside the safe injecting room at North Richmond Community Health. Photo, Darrian TraynorIt Center will open during the school holidays, allowing staff to tackle potential early issues before students return to the Richmond West Primary School just meters from the site. The school will have a CCTV system operating at its entrances and reception. New fencing will be installed to stop students from catching a glimpse of the center's clients, and lighting will also be improved in the school grounds and car parks. Medical supplies at the safe injecting room. Photo, Darrian TraynorIt Andrews government has no plans to open any other injecting centers. The North Richmond location has been written into legislation, which means the government would have to pass new laws in state parliament to open any other centers. The coalition has fiercely opposed the injecting room trial, taking aim at its proximity to the primary school and opening hours during afternoon pickup times. The opposition has also attacked the government's decision to allow ICE users to inject the drug at the center. The room's medical director Nico Clark said the calming environment would have a beneficial effect on methamphetamines users. "If people are calm when they leave here, then the likelihood is they will be calm when they are out in the community," he said. Dr. Clark said it would be rare that staff would need to call the police to deal with violent clients. Loretta Gabriel's son died in Richmond from an overdose at the age of 27. Photo, Darrian TraynorIt Loretta Gabriel's son Sam O'Donnell died about 500 meters from the injecting room almost 2 years ago. In addition to saving lives, she said the center would spare families from the trauma of being on high alert every day and fear their loved one will overdose with nobody to help them. "My family suffered that for 10 years up to the point where we were alerted to Sam's death in the middle of the night," she said. "My family doesn't want any other family to suffer that trauma." Ambulance Victoria Executive Director of Emergency Operations, Michael Stevenson, said paramedics were called to North Richmond hundreds of times a year to treat overdoses. "This is the epicenter of heroin injecting in Melbourne," he said. Opposition mental health spokeswoman Emma Keeley accused Premier Daniel Andrews of backflipping on the centre after initially opposing the idea. She said a coalition government would shut down the North Richmond facility if it won the November election.